Welcome to the Teeth Chatters podcast, where we chat all about the correlation between oral health and systemic health. My name is Sarah Giuliano. I have been a registered dental hygienist for over a decade. Now I'm about to branch out from the dental chair into the community to all you beautiful, amazing people. Together, we can connect the body to the mouth through educational podcasts. So let's get this show started. I've listened to my patients talk about their health issues and their struggles, and I've seen clinically how their diseases have impacted their oral health in so many ways. Every time my patients come in, I always ask them, first and foremost, any medical changes, any medication changes, any surgeries. Most, if not all of my patients reply, "Why do you need to know that? You're just cleaning my teeth." And I say, I do need to know that because guess what? Your mouth is part of your body. Oh, okay. Well, yeah, so this has changed and this has changed. Okay, so now we know why. Yes, and I'm not just cleaning your teeth. And there lies the problem. There is a huge correlation between oral health and systemic health. And I am here to bridge that gap. Your mouth is the mirror to your body, and that's why this matters so much. I am going to introduce my very first guest today. My first guest is INDI. INDI, how you doing?
Hi, Sarah. How are you?
I'm good. INDI's a good friend of mine. How you been?
Oh, I've been really good.
Good.
Thank God, everything is going well.
Good.
Health-wise, in general, everything has been good. How are you?
I'm doing great. Life's awesome.
Yeah, life is awesome.
Yeah.
Thank you for having me today.
Oh, I'm so glad you're here.
Yeah, I'm so glad too. And I think we have a really great topic to talk about today, and I'm very excited to get to it.
Okay, so what do you want to talk about today?
You had come to me with some of the research that you've done regarding systemic health and oral health and how they're related to each other and how they kind of affect each other.
Sure.
So I thought when a dentist or a hygienist asks you, is there anything going on with your health or has anything changed? Let's educate them to be open with the dentist and the hygienist and let them know what's going on. So I know we're going to talk a little bit about the rheumatoid arthritis, periodontal disease, the correlation between them, the arthritis in general. So I want to get to it, and I want to start with what is arthritis? That's, I guess, the main question.
Okay. Good question to ask for the first question. Awesome. So, arthritis is a very, very, very broad spectrum. There are over 100 different types of arthritises that are in the body that people can develop. Arthritis is really another word for inflammation.
Okay.
So, anywhere you can get some form of inflammation in the body is usually a form of arthritis. Most common form of arthritis is osteoarthritis. Osteoarthritis is more so wear and tear on the joints and ligaments and the bones from overactivity of a specific area in the body. Like if you're a baseball player or a football player and you're constantly throwing that ball, you're going to hurt your shoulder, and before you know it, you kind of have bone on bone. That's more osteoarthritis.
Okay.
That's the most common. Couple other ones we'll just touch on. One is fibromyalgia, gout, rheumatoid arthritis, which we know we're going to delve into
Right.
at some point, which is the most severe as well. But yeah, it is. It's such a broad spectrum. So what happens with arthritis is instead of your body being anti-inflammatory, it becomes pro-inflammatory, and it just causes inflammation, and that's where destruction happens.
So you mentioned there's multiple types of arthritis.
Yes.
And the most common one is arthritis and rheumatoid arthritis, and that's where I think we should dig a little bit deeper in. What's the difference between arthritis and rheumatoid arthritis?
So rheumatoid arthritis is autoimmune. So autoimmune means that your body self-attacks. It's attacking itself. Osteoarthritis and other forms of arthritis are not so much.
Okay.
Psoriatic arthritis as well as autoimmune. There are a couple other ones, but today we're really going to focus on rheumatoid arthritis. Rheumatoid arthritis is usually generalized throughout the body. So not only can it impact the joints and the ligaments and connective tissue around your bones, but can also affect your vital organs, your eyes, your skin, your hair, all aspects of your body, and it can really be degenerative and very painful.
It sounds very painful.
Very.
So now that we know the difference between arthritis and rheumatoid arthritis, let's go into a little bit deeper as far as what is rheumatoid arthritis on itself.
So, rheumatoid arthritis is an autoimmune overall systemic disease. So what happens is these little cytokines, we'll get back to those in a minute. There's these little cytokines in normal healthy bodies. What they do is they go to sites and signals in the body where there is inflammation or infection present. And they go and they attack and they become anti-inflammatories. In an autoimmune disease such as rheumatoid arthritis, what happens is these cytokines start to attack themselves because they look at them as foreign bodies.
Right.
When they're not foreign, but in the autoimmune disease, they are. So what happens is these cytokines become pro-inflammatories and they increase the inflammation. When the inflammation is increased, it becomes destructive and it releases toxins and it attacks the joints, the synovial fluid, the connective tissue, the ligament, and eventually the bone. And it's degenerative, and it can be aggressive and progressive and very painful.
Right. So you brought up cytokines.
Mm-hmm. Cool word, huh?
Yeah.
I know.
It is.
Did you ever hear of it before?
I actually have, yes. Cool. It is a very, very cool word, and it's interesting because there's a lot of information about cytokines.
Yeah.
And I think we should talk a little bit more about cytokines and what they do and what their purpose is in the human body and how it affects rheumatoid arthritis, which you kind of talked a little bit about it, but I think it's beneficial to mention a little bit more about cytokines.
Sure. So cytokines, like I said, are normally in healthy systems. They are beneficial.
Right.
So there's small little proteins that are essential for cell signaling, and they go whenever there's a form of inflammation, or like if somebody has a fever, or you get the chills or a cut, they're going to rush to that site and actually release anti-inflammatory enzymes to help heal the body. But again, in an autoimmune disease, what happens is these cytokines rush to these sites.
Right.
And instead of being anti-inflammatory, they become pro-inflammatory. And they create what we call a cytokine storm. Kind of crazy.
That one. Yeah,
I know.
I love that one. And if you were not going to talk about it, I was definitely going to bring that up.
Sure.
I really love that.
Storm meaning destruction, unfortunately. So they lose control. They don't know what to do. They don't know what direction to go. So they just start attacking and attacking and attacking. And that's where that destruction comes. And what it does is it decreases, and this is really important when we get into the correlation between periodontal disease and rheumatoid arthritis. These cytokines release an enzyme called hyaluronidase. So what the hyaluronidase does is actually decreases the hyaluronic acid in the body. Do you know what hyaluronic acid is?
I actually do.
Cool.
I do know about hyaluronic acid. I'm familiar with it a little bit because I'm familiar with the product and a lot of products actually recently, beauty products use hyaluronic acid as an ingredient. But hyaluronic acid on itself is an ingredient that is found naturally on the human body.
Yeah, your body produces it.
Yeah, mostly in the joints, right?
Man, you're smart.
Thank you.
Actually, it's interesting because after I had started researching rheumatoid arthritis and learning more and more about things that I wasn't aware of, I actually went ahead and bought myself some hyaluronic acid as well, too, because I do feel as we get older, wear and tear on the body, your body does start to break down and not produce things as it should. And I think, when we kind of get a little bit older, we're not spring chickens, right, Indy?
We are not.
He's like, speak for yourself, Sarah.
As long as we like to think that, we're definitely not spring chickens anymore.
But what's important is having that hyaluronic acid in our body is because it does help keep our joints and also our oral cavity moist.
Okay.
We need those fluid rejuvenations and the synovial fluid around the joints. And also it does help with your salivary flow as well.
Okay.
Yeah.
We talked about the cytokines and the hyaluronic acid. And I think we can now talk a little bit more about periodontal disease and
Sure.
how the information that we talked about is relative to the periodontal disease.
It is what I have researched and understood, and I find to be the most incredible. It is first of all, periodontal disease and rheumatoid arthritis are the most common inflammatory diseases of the body.
Okay.
Typically, when someone is suffering from rheumatoid arthritis, they normally are suffering from periodontal disease as well. That is how well correlated they are. The destruction that the cytokines do in the synovial fluid and the connective tissue and the ligaments, the joints into the bone is the exact same pathological response that happens in the oral cavity. These cytokines release the toxin in periodontal disease, and it destroys the ligament, the connective tissue, and eventually the destruction of the bone. And that's what periodontal disease is. It's necrosis or death of the bone that supports the teeth.
Okay. That is so interesting.
Yeah.
You would never think that periodontal disease, somehow it's related to an autoimmune disease. It's related that much. It is very, very interesting information there. Let's talk about more of periodontal disease. Let's talk get a little bit more deeper in there. So as a normal human or individual in an everyday life, a lot of individuals might be familiar with periodontal disease in general. They might know a little bit about it just by going to the dentist.
Sure.
But I think talking a little bit more, getting into a little bit deeper into the periodontal disease, I think will be beneficial for our listeners. So what is periodontal disease?
So periodontal disease can be very progressive. There's 4 stages of periodontal disease. First one, I like to call it more of a superficial disease, meaning superficial above the gum line. That's gingivitis.
Okay.
That's where the plaque accumulation sits on the teeth, sits in the oral cavity, sits on the tongue, and if not effectively properly removed by brushing, flossing, oral rinsing, proper diet, good, healthy systemic health, that plaque accumulates, and what happens is if not removed effectively, it migrates down below the gum line, and that's when it starts to attack. The main bacterium that's associated with periodontal disease is called P. gingivalis.
Okay.
Have you ever heard of that?
Yeah.
Yeah.
I've heard. Yeah, you mentioned that you have over a decade experience in the dental industry. I have about 8 years experience in the dental industry.
We got 20 years between us. This is awesome.
Yeah, absolutely. So I have about 8 years experience in the dental industry, and lucky or unlucky, I've been around periodontal disease and individuals that are suffering from periodontal disease.
Sure.
Which is, it is not something to be proud of, but at least it gave me the information that we're talking about today.
Right. So what happens is this P. gingivalis bacterium in the oral cavity. Now, mind you, let's get into this a little bit deeper with periodontal disease. There's over 700 different forms of bacterium in your mouth. People think that their mouths are the healthiest parts of their body. They're not.
700.
700. Not all bad.
Right.
But think about the food you eat. Think about what you're drinking. And if you're not properly removing where do you think the bacteria goes?
Right.
It just sits there.
Right.
And then it becomes destructive. A lot of the bacteria is destructive. Some of the bacteria is good. But this P. gingivalis that we're kind of getting into and talking about, this is very toxic to the oral cavity. And what happens is if you do not have a healthy immune system, it's harder to fight off that plaque. Just like it's harder to fight off infections in the body, you're immunosuppressed. So what happens with this P. gingivalis, if not properly removed, proper brushing, flossing, water picking, things like that, it releases these cytotoxins. And these cytotoxins release that enzyme, the hyaluronidase. Your mouth becomes dry, the plaque accumulates, and that's where these toxins just can destroy and do what they want to do. So that's what happens with the gingivitis. Yes, gingivitis is reversible. Periodontal disease, once it gets below the gum line, it's very, very, very hard for you to treat that individually at home. This is where
Right.
your dentist comes in and
Right.
says, okay, we need to find maybe different forms of treatment or have you come in more frequently to help maintain this. Because what happens is when those cytotoxins from the P. gingivalis start to attack and the connective tissue, the ligaments, the bone, unfortunately, it's irreversible. So it only progressively gets worse the less you maintain your oral health.
Okay. It's interesting. I mean, it is a great topic. And that's why I wanted to have this podcast today, because a lot of people don't realize that your mouth is a gateway to the rest of your body. Do you agree with that?
I 100% agree with that. And I really feel that this is why this podcast is so important to people like myself or you who's really interested in this stuff, because we need to get the awareness out that there is so much correlation between oral and systemic health. And between rheumatoid arthritis and periodontal disease, it is two of the same, just in different parts of the body, which I know we're going to delve into that in a minute too. But yeah, it's so important to just get that knowledge out there so people can understand that. And it not only will help their oral health, but their overall systemic health as well. Less plaque in the mouth, less plaque in the body.
What should people do then to prevent periodontal disease?
What people can do, coming from an oral healthcare educational background. First and foremost, go to the dentist every 6 months. Have your routine checkups. Have your routine cleanings. Let the hygienist get in there and do a proper thorough cleaning. Clean out that plaque and bacteria in your mouth. We can also, as hygienists and dentists, educate those and everyone who isn't suffering from systemic health issues. Really get that word out there about how important it is to have proper home care. And we can also, as hygienists and dentists, do thorough periodontal exams to evaluate the bone levels in the mouth, especially those suffering from systemic health disease, and really, really give the patient the proper care that they need so things don't progressively get worse.
Right. Yeah. You have to go to the dentist at least every 6 months.
Absolutely.
Having those x-rays is one of the main ways to realize if an individual is having periodontal disease or issues.
Same thing with rheumatoid arthritis. Now, if someone's starting to have, chronic joint pain and inflammation, they're going to go to their doctor, and their doctor is going to say, okay, let's do some routine blood work. Let's do a thorough, proper physical. Let's take x-rays. And that's going to help evaluate and see if there is bone necrosis in the joints.
Right.
It's the same thing in the oral cavity. We need to thoroughly, properly diagnose our patients, and that's what we need to do.
Right.
To do it properly.
Oh, I agree 100%. I couldn't agree anymore. We talked about the importance going to the dentist and the importance of having the 6-month checkup. But now, what can they do at home, just, if they're suffering from rheumatoid arthritis to improve their dental hygiene?
So what I always recommend to my patients, especially those suffering from systemic health, always say, let's get an electric toothbrush. We all are very lazy toothbrushers sometimes.
Yeah.
Little teeth brushers. We brush our teeth. We're always in a hurry. Let that electric toothbrush do the work for you. I know it sounds kind of crazy, but there's some great power toothbrushes out there now that have like Bluetooth with them.
Oh,
which
I
is,
agree.
Like they yell at you if you don't brush long
I know.
It's so funny.
You have an app on your phone and it tells you where you brushed, where you didn't brush, what to do, and it depends on your needs. There's also different ways how the toothbrush works. So if you need whiter teeth, it will work on that. If you need healthier gums, it will work on that. The technology has come so far these days.
And I agree with that 100%. It's like, why not utilize it?
Right.
Why not utilize it if you can improve your overall health?
Exactly.
Why not?
Right.
So those, especially patients that do have rheumatoid arthritis, they don't have the proper finger dexterity. Some don't, especially in severe cases where some of their hands, like they don't have the hand dexterity. They can't grip the toothbrush as well. I found a little trick over the years working with patients, which was really fun. You take a tennis ball, you cut a little slat in it, and you pop that ball at the base of the toothbrush, and it gives them a little bit more of a grip, and that helps as well, too.
Oh, that is a great tip.
with rheumatoid arthritis as well, too, they don't have the finger dexterity at times. Maybe not so much early on in the early stages, but, unfortunately, as it progresses, it can become more painful. It's hard to floss, right?
Right.
So I always recommend a water flosser.
Those are great.
They are great.
Oh, I got one recently, and I love it.
Isn't it fun?
I really love it. It's so easy.
We get so excited to talk about oral health, right?
I know, exactly. But it's so small. It's so easy. Doesn't take a lot of space in the countertop. So
and you use it every day, right?
I use it every day.
Awesome.
Every day.
Great. If you were one of my patients coming in the office, you'd get a 5-star. You'd get a star.
Oh, okay.
You get a gold star.
I get a gold star.
You get a gold star. But what I recommend, especially those, patients who do have periodontal disease, especially with a systemic health disease, I always recommend, put a little cap full of peroxide in your water because peroxide is a natural antimicrobial, as well as in conjunction, it will attack and kill those P. gingivalis bacteria. Which is huge.
That is great. Mouthwash, too, that helps, right?
Mouthwash is great. Yeah, nice antimicrobial rinse. And here's the other thing as well. Most people with systemic health are on medications. Okay, everybody, we're going to take a little break breather in between that very heavy, informative teeth-chatting podcast. So I have a couple fun facts about rheumatoid arthritis I just wanted to add in there. The earlier rheumatoid arthritis is diagnosed, the more aggressively it is treated, and the better the prognosis, which is fantastic. Another fact about rheumatoid arthritis, stay active. Active. A lot of people think, oh, I'm in pain, I need to sit. No, motion is lotion. You need to stay active. The more you move, more so less weight-bearing exercises like yoga, tai chi, meditation, walking, swimming. That's actually going to help increase the synovial fluid around your joints. So motion is lotion. Stay active. Oh, yeah. And I want to add one more thing about rheumatoid arthritis, another fun fact.
Okay.
So there's newer, even more progressive, aggressive, modifying biological therapies that doctors have come. So doctors are treating rheumatoid arthritis even more aggressively. So there's even better prognosis than there was 8 to 10 years ago with the Jaconibs and the Biologics. They're really intensifying this, which is great.
That's great.
It is great because also, too, the methotrexate that most patients are on with rheumatoid arthritis. Like I said, a third of these patients suffering from rheumatoid arthritis are not getting good responses from that. So, this is great news.
That's great, yeah.
To go in remission.
So, absolutely. So I have some fun facts about periodontal disease.
Ooh, fun. Let's hear them.
They're not fun. They're just more facts, right?
Okay.
Nothing fun about a disease is funny, but just some facts in general. So listen to this.
Okay.
Adults that are age 35 and older lose more teeth to gum disease than to cavities and decay.
Wow.
Isn't that crazy?
That's scary.
Right.
This is why this is so important to really learn about this. That's scary.
Exactly. Exactly.
Wow.
And then I have another one.
Okay.
It has been found that people with periodontal disease are almost twice as likely to suffer from coronary artery disease as those without.
Wow.
Isn't that another crazy fact?
And can I tell you, too, that would be another great podcast.
Yeah.
To talk about.
Well, that's a great, yeah.
That's again, that is very scary.
Right. Yeah.
Wow.
I don't know why I called them fun facts, but they're scary facts.
They're scary facts, and this is information. I'm so glad that you're bringing this to us because we really need to get into that.
Yeah.
That's very scary.
Yeah.
Wow.
And I also have another one that I think it's a little bit scary
Wow, you're blowing me away here. Wow.
So pregnant women who have periodontal disease may be 7 times more likely to have a baby that is born too early or too small.
Wow. And it's
Think about that.
That's
7 times.
7 times?
Right.
That's awful.
Right.
Wow.
Right. So that's why oral health is very, very important.
Absolutely it is. I'm so glad you're bringing this to the podcast today because we have so much to talk about in the future.
Exactly.
Wow.
Exactly.
Now, remember we talked about with rheumatoid arthritis. I'm going to refresh you a little bit in case you're sleeping over there.
No, I am not. This is a great topic.
So, with rheumatoid arthritis, it releases, that P. gingivalis releases those cytotoxins, and the cytotoxins release an enzyme called hyaluronidase. That is so difficult to say.
I know, it sounds like hollandaise.
I know, you're so hungry. I could tell.
Well,
we'll get lunch after this.
I know, I do need some lunch at some point.
So what happens is the decreased hyaluronic acid in the oral cavity as well as around the synovial joint, you're going to have dry mouth. In conjunction, think about the medications that patients are taking with rheumatoid.
Oh my God.
That dries you out even more.
Yeah, there's over 500 medication that cause dry mouth.
That's like all of them.
Isn't it crazy?
It's crazy.
Over 500.
And it's so sad because I understand that, they're trying to help people with their systemic health. And that's where we come into play when the oral health, yes, we understand that these medications are vitally important for your systemic health.
Right.
But here's what's happening to your oral health. Let's merge the two. Let's bridge that gap. Let's improve everything. That's our job.
Here's another statistic that I think you would like regarding dry mouth. 1 in 4 people suffer from xerostomia.
Wow.
Now, what is xerostomia?
Xerostomia.
Yeah, I mentioned the medical term of it, but basically it's dry mouth.
Yeah, right. It's a fancy word.
It's a fancy word, right? But it isn't that crazy? 1 in every 4 individuals suffer from dry mouth.
Right. And that's where our objective is with this podcast, to really broaden that education out and say, listen, do you have any idea what dry mouth can do to your oral cavity? Plaque will stick to your teeth. That P. gingivalis is going to increase.
Right.
You're more prone to gingivitis, periodontal disease, and that plaque's going to migrate somewhere.
Right.
It gets into your bloodstream or your saliva, and it just migrates through tissue migration, and then it starts to become destructive throughout the body.
Right.
One thing I want to add that I don't think we talked about, which is really important. Researchers have found in cases with people who have rheumatoid arthritis that P. gingivalis bacterium is in the synovial fluid around their joints.
No way.
Yes.
So that's
the same bacterium.
Wow.
Same bacterium. How does it get there?
That is very interesting.
How does it get there?
Right. And that's why your mouth is a gateway to your body.
Absolutely.
Wow.
Yeah. Crazy.
That is a great point.
Yeah.
I think, Sarah, I know the two of us are excited about this podcast and this topic in particular, but I think this information will help a lot of individuals out there.
I agree. And I'm hoping that what we're going to do, our main objective is to really delve into topics that have to do with systemic health and how that correlates to oral health, and really just bridge that gap.
Right.
That's my main objective. I want to help people. I want to reach people, and I need people like you to come on the show and be just as passionate about it as I am.
Well, I'm very happy to be here, and
thank you.
Anytime you want to invite me over, I will be more than happy to be here and talk about the relation between systemic health and oral health.
Thank you.
So we talked about rheumatoid arthritis. We talked about the relation between the rheumatoid arthritis and periodontal disease.
The direct correlation.
Correct.
Crazy.
Yes.
It's same thing, just different parts of the body.
Exactly.
Right?
Exactly. But now let's kind of talk a little bit more about rheumatoid arthritis and talk a little bit about, is there any cure for rheumatoid arthritis?
Unfortunately, there is not a cure for rheumatoid arthritis. However, in the last few years, researchers have done a lot of studies, and they've done a lot of case studies. So here's a little tip. According to the National Library of Medicine and National Institute of Health, This is a systemic review that they have done on rheumatoid arthritis patients.
Okay.
1/3, now think about this, 1/3 of all patients suffering from severe rheumatoid arthritis are not achieving remission from the rheumatoid medications that they're taking.
Oh, wow.
That's a lot.
Yeah.
So what they're doing is they've generated biologics for rheumatoid arthritic patients.
Okay.
So what biologics...
What's biologic?
I know, we're getting a little deep for a minute.
Okay. Well, let's know. We definitely want to talk and cover everything that we know and,
Yes.
and that you research.
Absolutely.
And I think it will help
broaden
our
that
listeners.
knowledge.
Yeah, absolutely. So what is biologics then?
So remember when we talked about the P. gingivalis bacterium and the cytokines, and they release this enzyme and how they do their destruction? So what biologics are is they're a form of medication that they alter the cell signal outside of these pro-inflammatory cells. So they kind of throw them off.
Okay.
Like, wait a minute, you're not going to do this. I'm here to kind of fight you
Okay.
off now. So that's what biologics are. They work from outside the cytokine cells, but they have done further research with these little target synthesized cells called jackanibs.
Oh.
Those are fun.
That's a fun name to say.
It is kind of a fun name. So what they do, they're for anti-arthritic patients. So it's an anti-arthritic medication.
Okay.
So the jackanibs actually can get inside those cytokines, okay? So the biologics work outside the cell to kind of mess up the cytokine. The jackanibs actually get inside the cytokine so that they can't be the pro-inflammatory destructive cells that they become in autoimmune patients.
Okay.
So what it does is it gives patients who have rheumatoid arthritis a lot of hope that they can slow the progression of rheumatoid arthritis because these jackanibs are actually decreasing the inflammation within the cell so that the synovial fluid doesn't wear down and break down, so that their symptoms are
milder,
much more mild.
Yeah.
But almost what they're saying is that a lot of these RA patients are going into complete remission.
Oh, wow.
Yeah, so that is huge news. And they started this, I want to say about 8 to 10 years ago. They really started delving into this because rheumatoid arthritis is very painful and very severe.
Okay.
So it gives us hope.
Well, yeah, that's great news.
Yeah.
That is great news. I appreciate you doing the research and talking about this.
Thank you. Anything else to add? Are you good? I think we've covered everything today.
I think we've definitely covered a lot. I'm sure that we'll do some more research and maybe have a second part of the show.
Okay.
I
would love that.
Yeah, that would be great. But I think for now, I think we covered a lot of grounds and we talked a little bit about everything and
Right. And I just want to add a couple more things. Are you good?
Yeah.
I'm sorry, I didn't mean to cut you off.
Go home.
Oh, hey, go home.
Go on.
Go. Go, girl.
Bring it home.
Bring it home. I'm gonna bring this all together. So I just want to just say a few more things, especially those in the medical, dental field. Always ask your patients if they've had any medical changes, medications, surgeries. We need to know this as well because then we can see clinically, orally, what's going on in the mouth and really help them maintain good oral health. For all the rest of you listeners out there, remember, keep your mouth clean. The less plaque you have in your mouth, the less plaque you have in your body. So keep them clean and healthy. And for everyone, just to let you know, rheumatoid arthritis can be very painful and debilitating at times and can be very severe. So if you know those who are suffering, please treat them kindly and have compassion.
Thank you.
Thank you. Thanks for joining me today,
thank
Indy.
you,
This
Sarah.
was fun.
It was a lot of fun. I really appreciate your time.
You're welcome. Looking forward to next time.
Next time.
Okay.